Injuries from trauma, they're an unfortunate reality here today in our country. We can't always prevent these types of injuries, but there's sure some things that we can do to minimize the number of lives lost. Stop the Bleed is a fantastic national initiative that Upland Hills Health here in Dodgeville is taking on, and we are here at Upland Hills Health to learn more about it. We're joined by a fantastic team of panelists, including Dr. Joseph Hansen, part of Madison Emergency Physicians, Brian Mitchick, who also serves as the trauma coordinator at Upland Hills Health, registered nurses Josh Taylor, Laura Erdman, and Patty Hinderman, Director of the Emergency Department at Upland Hills Health here in Dodgeville. I'm Justin Riley. Wisconsin Doctors starts now. Welcome back to Wisconsin Doctors. Today's topic is the Stop the Bleed program. So we're really excited about that. We're at Upland Hills Health to find out more, and I'm joined now by Dr. Joseph Hansen. How are you, Dr. Hansen?
Excellent. How are you doing today?
Very good, very good. So tell us a little bit about what is Stop the Bleed and how did it get started?
Yeah, so Stop the Bleed was actually developed as a response to the Sandy Hook Elementary School shooting in Connecticut. The Hartford Trauma Center really noticed the pattern of these injuries and said, you know, if we can't prevent these injuries from happening, what things can we do to try to reduce the mortality rates, to try to help save lives on the scene? So they went and looked at military science, which really knows more about high velocity bullet injuries and blast injuries than anyone else, and said, how can we help bring some of that knowledge we have into the communities to help save lives and be prepared for these mass casualty events?
Absolutely, and it's a shame that things like that have to exist in this society, but is this something that all communities are doing or only certain communities?
So in 2015, the White House took the recommendations that came out of the Hartford group, which is out of the Hartford Hospital, along with the American College of Surgeons, who's responsible for really all trauma care in this country. The White House took those recommendations and brought this program, the Stop the Bleed program, out to the communities, and the goal is really to get life-saving bleeding control, both information as well as supplies, out into the community, so malls, schools, any public spaces.
Absolutely. And let's talk a little bit about some of the ABCs, as you will, of the Stop the Bleed program. What exactly is it, and what are the basics?
So we took the ABCs of a lot of first aid care and just applied them to hemorrhage control.
Okay.
So the first thing to realize with all emergencies is to make sure that you're safe. So don't rush into a situation where you're going to put yourself at risk, because now we have two victims and an injured victim can't help another person. So looking around, making sure, as we say in EMS, that the scene is safe is the first thing before you get onto the ABCs. And then the A is to alert. So call 911, get some more help. B in this case is to look for bleeding. And that is both just looking at a patient, say, is there a large pool of bleeding developing from around their body? Is there spurting blood, or is there bleeding and it seems like they're starting to pass out? That would suggest that there's a significant injury that needs to be controlled. Then you need to find that. So find the bleeding is B, meaning remove some of the clothes, cut away some of the clothes if you need to. And then C is compression. So you're going to compress the site with the number of things we're going to talk about later in order to control the bleed.
You know, it's interesting to think that, you know, people who've never been in a situation like that may not realize it may be difficult to determine where the bleeding is coming from.
It really
so
can
having
be.
to remove clothing and things like that to make that determination to find the bleeding is important.
Absolutely, and then sometimes there can be multiple wounds, so that's why it's important if you see blood coming from an area to try to get some of those clothes off, and it's just easier to manage that wound then. And once you have found the bleeding, then we go through some of the steps that we've learned from pre-hospital care and from the military, and those really are essentially compression, so putting direct pressure on wounds. Next would be packing a wound, so actually putting things into the wound to help control the bleed. And then the third thing, which has gained a lot of popularity and we've seen it save a lot of lives in Afghan and Iraq conflicts, is the use of tourniquets.
Yeah, let's talk a little bit about tourniquets, is because there's, we were talking a little bit before the show started, how there's a little bit of controversy maybe surrounding tourniquets and maybe, you know, whether or not this is something that should or should not be used. Tell us a little bit about that.
So tourniquets are ancient, and they've been first recorded use was 400 BC, but probably have been used far before that. They were really popular in wars, and then in World War I particularly, the problem was they'd be placed and then couldn't be removed. So there were a lot of amputations that occurred, and maybe some of them not necessary. So the tourniquets sort of fell out of favor. They gained popularity in later wars, and then we've really seen in Iraq and Afghanistan where we're able to get injured people to a trauma facility where their wounds can be addressed quickly, that really, if you're able to get that tourniquet off within 2 hours, there's never been a limb-threatening injury from that. So anybody who has a worry of, should I put this on, shouldn't I put it on, in this country, you're going to be able to get to a trauma facility most likely, unless you're somewhere in the wilderness, within 2 hours. So I think putting it on and erring on the side of controlling the hemorrhage is the most important thing.
Controlling the hemorrhage and making sure that time is on your side.
Exactly.
So,
exactly.
Dr. Joseph Hansen, thank you so much for joining us. Don't go away. There's more Wisconsin doctors. We're going to continue talking about Stop the Bleed right here at Upland's Health. And you might even see a couple demonstrations. Stay with us. Stop the Bleed has been our topic of conversation today here at Upland Hills Health on Wisconsin Doctors, and I'm joined now by Brian Mitchick and Josh Taylor. How are you guys?
Good. Great.
Good to have you with us on our show today. So we're going to talk about something called compression and packing. So I'm kind of excited to see, because it looks like we have a demonstration here. So let's talk a little bit about compression first. So we've got a couple of examples. Tell us what we're seeing here.
This could be a gunshot wound, a stabbing. It could just be falling on a rock, a piece of glass.
Okay.
Anything, usually creating a deeper
Something that would take
wound and may involve an artery.
Got it. Okay. So when we're talking about compression, which is obviously applying pressure then to the wound to stop the bleed, what's the best way of going about that?
Well, first of all, you're gonna, if you got any cloth, any shirt, any clean cloth, the cleaner the better. To help with that, that will help you, and it'll also protect yourself. There are certain areas where you need to do compression. You need to do compression.
Okay.
Shoulders, groin, areas where you cannot apply a tourniquet for EMS.
Got it. Okay. So that's kind of our rule of thumb, is that if you can't apply a tourniquet to it, then pressure, we got to rely on pressure.
First line is pressure.
Okay. Got it. Or compression. So let's have a demonstration. How do we go about that?
Okay. So I'll show you on my arm here, and you're going to do this one here. And so it can be just a shirt.
Okay. So
this could be the shirt that you were wearing. It can be a clean shirt, towel, whatever. Okay.
Right.
If you got gloves, that's great. If not, you're going to you find your wound that's bleeding, either uncontrollably or spurting.
Okay.
And put in direct pressure. You're going to put
without putting the shirt on.
You can put the shirt on.
Okay.
I don't have
All
it.
right.
So you're going to put 15 pounds of pressure.
Okay.
Okay. And you're going to hold.
Okay.
And hold. And hold until somebody can get a hold of EMS.
Okay.
And get further supplies for you.
Okay. So that we have to keep holding until somebody else can get here to help us out then. So. And is there a good rule of thumb for what 15 pounds of pressure feels like?
It should, you need, one, it's going to help stop the bleeding or slow the bleeding down.
Okay.
Two, it is significant amount of pressure.
Okay.
I mean, it's
More
putting
than
your
you
weight,
probably think,
it's putting more in your weight. It's not just your hand.
Right, okay.
Yep.
Gotcha. Okay, so then would packing kind of be the next step then, Josh, then? Or is that something, used in a different situation?
Yep, so if you have packing available, the part of this program is to get these.
Can I let up on this yet?
You can, for demonstration.
The point of this program is to get these kits out into the public. These kits have these essentially little packing kits that have an agent on it to stop the bleeding.
Sure.
So go ahead and open it.
Okay.
And it's going to be a bunch of gauze folded up nicely. So this is where you have to get out of your comfort zone and actually get inside the wounds.
Okay.
So once again, if you have gloves, that's great. If not, what you want to do is take it with a finger.
Okay.
And you want to put it all the way deep down inside that wound.
Oh my goodness.
And just keep forcing it down.
Oh.
Keep your finger in
Yep,
there.
keep your finger in it and keep holding it. 'Cause you want to keep holding pressure wherever it's bleeding and pack it as much as you can get into there. And it's going to feel like you're going to run out of space, but you can keep tucking it around the edges. Those wounds have a tendency to open up underneath that you can probably get this whole pack of gauze in there.
Wow.
And this is going to hold direct pressure that you don't have to put that 15 pounds of pressure on top of it.
Okay.
So say you get it all in there, which you're getting close. What you can do,
I think you're beating me here, but
it's not my first time. So So then you can put it right on top, and then you can continue to hold pressure.
Okay.
Until
All right.
EMS or whomever
Okay.
gets on scene.
So compression still needs to continue with this.
Yeah.
Even though you've packed it, it can't just be something where you
No,
walk
you can't
away.
walk away. No,
Okay.
but you can put the tourniquet on, and then hopefully the bleeding stops with this in it, because this has that agent on it that I spoke about.
Yeah.
That should stop the bleeding.
And you had talked about, we just got a couple seconds left, but you had talked about spouting blood. Is there a time where packing would not be a good option? Like if you just have to get pressure on it and there's no way to, because I would think that, taking my hand off of it so I can pack it would be something that would cause it to bleed more, potentially. Is that something that has to be considered?
Depending on how deep your wound is, I mean, ideally the compression on top will stop it. But
Okay. All right. Good information. All right. We're going to take a short break. When we come back, we're going to continue talking about stop the bleed and maybe have some more demonstrations. Don't go away. Back here at Upland Hills Health on Wisconsin Doctors talking about Stop the Bleed. And we've gotten some great information and also some great demonstrations, and we have another one coming up here. But first I'm joined by Laura Erdman and Patty Hinderman. Welcome back.
Thank you.
And welcome to the program.
Thank you.
Good to have you with us today. So we're talking tourniquets in
Yes.
this segment. Tourniquets are easy and fun, as you told
They
me
are
during the
fun
break.
and they're super easy.
Okay, all right.
Yes.
So show me what to do. So let's,
Okay.
how do you go about this?
The first thing you're going to do is you want to identify where the wound is, and
Okay.
you want to make sure that a tourniquet never goes on a joint. So like an elbow can't go on a shoulder, can't go on a
Okay.
hip, can't go on the knee, because you won't get enough pressure to stop
Okay.
the bleeding. So once you see where the wound is and you can visualize there's not one above it, you're going to take the tourniquet and you're
Okay.
going to slide it underneath of their arm or leg. You want to go about 2 or 3 inches above where the wound is. Has a little clip, pop the clip in. You pull it snug so that you can't get your finger underneath here.
Okay.
And you're going to turn this 3 times. 3, or until the bleeding stops. And then
Okay.
you're going to take the windlass and put it in the clip.
Oh, okay.
And then it holds the pressure.
So this is going to be part of those kits that,
Yes.
that we're going to be seeing hopefully
Yes.
around more often.
Yep.
Okay.
And you still can put the compression on top of this. You
Okay.
can still put a dressing on it.
Okay.
If you have the tourniquet on and the blood is still just pouring out, leave this.
Okay.
Go 2 inches above it and apply
Okay.
another tourniquet.
Okay, you can do multiple tourniquets. And when you say above, you're talking like closer to the heart then. So
Correct.
this is the heart's on this side of the wound. Okay,
Yeah. So
gotcha.
like, that's where the foot was.
Gotcha.
This is-
Gotcha. Okay.
Yeah. And then you want to date and time it. You want to time what time you put it
Oh,
on
okay.
there.
Gotcha. All right.
If you've got a marker in your pocket.
All right, so you can make a mark on
Yes.
that. That's good. That's good to know.
So-
And again, tourniquets are safe provided that you can get to a trauma unit within 2 hours. I think was
Yes.
what
Right.
Dr. Hansen
Yeah.
had said. So okay, so I think we're going to do a live demonstration here today. So are you ready, Patty?
I'm ready.
All right, and I think that I'm going to be the one doing this.
You are.
So you should be very afraid. No, I'm just kidding. So just out of curiosity, some people might be wondering about this. They may not have one of these devices or the kits available near them. Is there something they can use instead? I mean, can they just use
You
a
can use
piece?
your belt, piece of rope,
Okay, a belt
just
would work.
something, just nice and tight. If
Nice
you've
and
got
tight.
another person to help you put pressure on that,
Okay.
and get the compression, because you need that compression on the veins and arteries to stop the bleeding from
Got
coming
it.
out.
Got it. You ready?
Okay,
All right, here we go.
I'm not afraid.
Not afraid. This will be fun. All right, so Patty is our real life patient here. So where you have to tell me where the wound is here.
So we're gonna have her wound on her lower leg.
Okay.
So,
So what I want to do it just right above, right here, kind of
so
between
you want
the
to
knee.
feel where her knee is.
Okay, knees right here.
Yep, and her wound's gonna be here.
Okay, so right here then would be
Correct.
where I want to put that. Okay. Let's see how I do on this.
You want to make sure there's no twist in that bottom
Right.
cord.
Yep. Okay. And then,
You want to go down just a little bit so you're not on that joint.
oh, like this.
Yeah,
Got
there
it.
you
Okay. So then this clicks here, and
Correct.
then I tighten it like this,
Yep. And then maybe pull it straight down this way.
pull it straight down.
Yeah.
Okay.
And you want it so that you can't stick your finger in
Right.
here.
And do I have to hold this then
Nope.
before I? Okay.
This will put pressure on it and hold that straight.
Got it.
And then-
3 turns.
Correct.
3 full turns.
Or until the bleeding stops.
Okay.
And Patty, it's going to hurt because it's going to be pressure on that leg.
How we doing?
Good.
think I'm getting it. All right.
There. And the bleeding stopped, and she saved her foot.
Thank you for saving my
she's-
foot.
Yeah, you bet. So now how do we release it?
So you're just.
We do, right?
Well, we will today. Wow, you
Hey,
got
I
some
did a good
pressure
job
under.
on
Yeah, you
that.
did.
Look at that. Look at that. One of the things that it's worth noting, though, I think, is that, you know, obviously someone's probably already in quite a bit of pain if they're suffering from an injury like that,
Correct.
and this is not going to make it feel better in the moment. So
No.
it's important for people to know that even though people might yell and say, no, don't do it,
Right.
it's to save their lives, save their limbs, literally.
Yes.
So making sure that you follow through on that.
Yeah.
So.
If you apply this over top of clothing, and it still is oozing, and you're going to put a second tourniquet on, just make
Okay.
sure the clothing is a little more straight.
Okay.
Sometimes this can get bunched up, and then that causes a gap, and it lets blood flow through
Got
there.
it.
So you want to, if you can get all the clothing off
Clothing
there,
off,
that's
yeah.
better.
Okay.
If not, just try and get it as smooth as you can so it doesn't bind up underneath of
Now,
it.
if I put a tourniquet here, it's still bleeding, and I want to do a second tourniquet. Her knee's right here. Should I go above the
Yes,
knee?
then go
Okay.
above the knee.
Good information. Good information. We got to take a short break. We're going to come back. We're going to continue talking about Stop the Bleed here at Upland Hills Health. We're back here at Upland Hills Health. We've been talking about Stop the Bleed, which is a program that's spreading across the country, really, and it's has its not really it starts here at Upland Hills, but you guys are kind of one of the first, it seems like, that because it's the first I've heard of it. But anyway, the staff here is going to test my retention level today because they taught me a couple of things, and they're going to see how well I did. So, are you ready to correct me if I make a mistake here?
Absolutely.
All right, here we go. So we learned about compression. So if there's a wound, and obviously blood's coming out of it, then we want to make sure that we put 15 pounds of pressure and hold it. Is that right? Did I get that right so far?
Yep.
Okay. And then we talked about packing as well. If we have one of these available to us, we really want to try to get as much in there as possible. So really kind of stuff that full. And then once we feel that it is pretty much as much in there as we can get, then we continue to use compression. Is that correct?
Yep.
So this doesn't just stay by itself. We want to try to compress it as much as possible. And again, putting the 15 pounds of pressure. And then tourniquets, right? So we're going to talk tourniquets. How am I doing so far? Am I doing all right?
Awesome.
All right, here we go. And is this the right? This is the right way, right?
Yep.
Okay. So we want to go on underneath here. Whoops. Sorry, I just tipped the patient over. And I think this thing is underneath. All right. Oops. So this hooks like that, right?
Let me just pull all the slack out.
There you go.
I'm having trouble getting it hooked there. There we go. All right. Are we good? I can't get my finger underneath there. So we're
Right.
doing good there.
Right.
And then 3 turns
Or until the bleeding stops.
or until the bleeding stops. Okay. Hook that in place. And if it continues to bleed, then we can add another tourniquet 2 inches above the wound.
And you are
And then
going
to date. And we got to make sure that we put the time and the date on there. So, okay. So did I put this tourniquet in the right spot, or would you have done it closer?
Because the wound is down here a little bit, I probably would have come.
Right about there? Okay. So maybe this would be
Once
a good
it's
spot for
there,
the
though,
second
you
tourniquet.
wouldn't want to remove this and move it
Right,
down.
right.
Right.
But this might be a good spot for the second tourniquet if need be. So, okay, great. How did I do? A to B? A to
B plus.
B plus? All right, I'll take it. I'll take it. It's better than what I did in high school. So let's talk a little bit about March 31st, because you guys have a class where you can actually legitimately get trained on this kind of stuff coming up on March 31st. Somebody want to talk about that?
Sure. It's here at Upland Hills Health in the conference rooms, and it's at 10 a.m. It's a free class, so please, hop onto the website and check out the details and sign up. And if one class fills up, we're going to be here throughout the day, and we'll add an extra class or 2 on if need be.
Okay, so if you get there later, if you sign up late, they might add some classes for you, so that's kind of nice. And
Right.
March 31st is National Stop the Bleed Day. Did I get that right? Okay, and that's been designated now,
Designated.
so what a perfect day to have that class. Brian, I'm going to ask you, because you are the trauma coordinator here at Upland Hills, why do this? Why take on a project like this?
Well, we as Upland Hills are committed to our trauma program. We are a level 4 trauma center.
Okay.
Level 1 being the highest one in the state. You
Okay.
know, most that can deal with the trauma the best.
Okay.
The most severe trauma. We want to provide the best service that we can out here, and teaching people pre-hospital and being able to stop the bleed. The earlier you can stop the bleed, can hopefully prevent life loss.
Yeah.
We also are involved in the SARTAC, which is the South Central Regional Trauma Association.
Okay.
Okay. We go to every other month. We have a meeting. Involves all the hospitals, levels 1 through 4 in
Okay.
the South Central region. We meet and discuss. This has been one of our big top priorities for the SARTAC.
So, you know, being a level 4 trauma center, this is something that you still want to, I mean, it's always about improving what you can offer to folks, even as a level 4 trauma center, it sounds like.
Correct.
So, yep. Awesome. It's
We all
awesome
have
stuff.
the same training. It doesn't
Yep.
matter if you're a level 1 or a level 4. And it's our initiative across the state to teach as many people as possible.
And hopefully we'll be seeing more and more of these kits around malls, schools, things like that. And hopefully we never need to use them, but if we do, they're there for us. So anything else you want to add before we
Well,
wrap up?
we're trying to get everybody trained in our community, in Iowa County, our schools and businesses. So please come to this class. We're going to try to go to the schools, maybe teach the teachers, go to businesses, and get these packs throughout our county.
Awesome stuff. Well, Patty Hinderman, Josh Taylor, and Brian Mishik, thank you so much for joining us today. Also want to thank Dr. Joseph Hansen and all of our viewers. From all of us here at Wisconsin Doctors and Upland Hills Health, we invite you to live longer, live better. We'll see you next time.